Hello, 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 everyone, and welcome to another edition of Ask Dr. Dansinger with Dr. Michael Dansinger, world-renowned diabetes reversal expert with diabetesreversalpartners.com. Make sure to visit his website to learn more about his practice in New Hampshire, in Massachusetts, in New York, in Virginia, in Minnesota, and in Florida. Lots of opportunities to take advantage of his program if you have Medicare and you have Medicare Advantage PPO plans. If you are heading into open enrollment and you are trying to make a choice as to what insurance you are going to take going into 2026, this is worth the consideration to make sure you can take advantage of Dr. Danzinger's services because he has been just a critical part of so many patients in our community and helping them to reverse diabetes. Today, everyone has asked us to talk about anti-inflammatory diets and how they relate to diabetes and peripheral artery disease, that poor circulation in mainly the legs. It's a disease that is more prevalent and deadlier than prostate cancer, breast cancer, and colon cancer combined. I know, but there's something you can do about it. And Dr. Danzinger is here to help us figure out the whole diet thing so that we can stop our arteries from going up in flames. Right, Dr. Danzinger?
Absolutely. It's a great topic, anti-inflammatory diets. And yes, inflammation is like a burn, like your arteries are on fire. We've talked about this many times. So most people's arteries are inflamed if they have peripheral artery disease, and food is some of the best medicine to keep your arteries healthy.
So let's dive right in because we got quite a few questions that came in. We also have a live studio audience. We have folks that are on YouTube and Facebook that are tuning in. Make sure if you do have a question for Dr. Danziger, just go ahead and type it on in comments. If you're in the live studio audience, you can go ahead and raise your hand or type in comments as well. But I want to get to Emily's question. These are in just random order as they came in. So Emily asks, I have type 2 diabetes, and recently my doctor diagnosed me with PAD. How do I choose foods that help both blood sugar control and reduce inflammation in my arteries? Loaded question.
It's a great question, a very common question. So the good news is, if your goal is to improve your diabetes and blood sugar and inflammation in your arteries, you can pretty much use the same eating strategy to do those things together. So, what is an anti-inflammatory diet in the first place? I think that's a big question on people's mind. And I would say it consists of, number one, avoiding inflammatory foods, and number two, eating anti-inflammatory foods. So the most important part about an anti-inflammatory diet is actually avoiding anti-inflammatory foods. So this many
Seems simple
kindergartners,
enough. We're talking about ultra processed foods, I
yeah,
would
many
imagine.
kindergartners would be able to list 10 foods, and even if they don't know what inflammation is, so chocolate cake and cookies and candies and soft drinks with sugar and all the things that are obviously unhealthy are the biggest offenders. And almost everyone eats that stuff once in a while, but eating it much less often, that's a big part of it. Chips and all these treat foods. So all these food, manufactured, some people would call them fake foods, avoiding those most of the time, that's the most important part of an anti-inflammatory diet, all the processed sugar and starch. But what do you eat? Well, it's healthy foods. So there's, and we'll get into some details, but there's all the things that are known to be healthy, good foods are anti-inflammatory. So that's the general idea, and we'll get into more details as we go through the questions.
Well, I'm going to share something that is going to turn an inflammatory food into an anti-inflammatory food. And you are going to be so proud of me. I was almost wondering if next week I should actually do and make it live for everybody. But I was challenged with making healthy Reese's peanut butter cups, not just healthier, healthy. Now, how in the world do you do that? Well, one, I completely removed the peanut butter. And two, the chocolate, so the shell part of it that you put a little bit in the bottom, a little bit at the top. So I ended up using raw cacao, huge superpower antioxidant, right? Raw cacao. And I mixed it with just a tiny bit of organic coconut oil, virgin coconut oil, just a tiny bit, a little bit of raw agave organic, which I'm sure you have a different option for sugar that you would want to, a little sweetener that you'd probably want to share. But we use organic raw agave, and it's just a little drip. And then I add a little bit of collagen, and I sprinkle in some ground chia seeds. And I put it over the stove top. I just melt it just a little bit, put it in the pan, and then the filling. No peanut butter, no almond butter, nothing like that. I got creative. So I mixed coconut milk, which is unsweetened and organic, with a whole bunch of chia seeds, and I let it just soak for about 20 minutes till they were really soft. And then I added spirulina, collagen powder. I added Ceylon cinnamon, and I added, gosh, what else did I add? Oh my goodness. Um, oh, this is it. Beet powder. And I mixed it all up. I set it in the freezer for just a few minutes just to get it really cold, put it in the middle, and then I added more chocolate on top, put it in the freezer, and I think voila, healthy chocolate cups.
I
What do you
love
think?
your creativity and your ideas. I would love to see how that tastes. Did you have a chance to taste it?
I did, and my dad even liked it. The only thing that I would change this time is I kept him in the freezer. I would actually make just enough to keep in the fridge that I could eat, throughout just the week. And so they would just continue to be soft. But when I first, I take them out of the freezer, I put the lower shell in, stick it in the freezer for about 5-10 minutes. Then I add the filling, stick it in the freezer for about 5-10 minutes. Then I add a little bit more of that chocolate on the top, stick it in the freezer for about 20 minutes after that. And it's still soft in the middle. And it just oozes out with this wonderful spirulina chia seed filling that has beetroot powder and collagen and all of the good stuff. But it hardened after a couple days. So I would actually, just because I really like the oozing of it, I would keep it in the fridge.
I
Are
love
there
it.
samples?
Who is that, Marina? Um, I know I should send them to people. I couldn't believe my dad actually liked it too, and he was craving it. He asked for it the other night. So just an idea for you. You could actually use unsweetened almond butter or cashew butter as well, but I thought that mine actually made it healthy, not just healthier. Although you would probably change my sugar, wouldn't you?
So I love dark chocolate, and um, I've become a fan of allulose sweetener, which
Okay.
can melt right into your chocolate. I've seen at Trader Joe's, I saw chocolate chips made of with allulose in there, and stevia is a great sweetener, and a little bit of agave is certainly fine.
Good. Yay, we got Dr. Dansinger's approval. So this week we're going to post that video. If anyone's on my regular Facebook page, they may have seen it, but we're going to do an official video with how to do it this week. So stay tuned for that. Okay, Michael has a question. When I see terms like anti-inflammatory diet, what exactly does that mean for someone with diabetes and poor circulation in their legs? And are there key foods? You said you were going to get into the specifics, so here's an opportunity to get into some of the specifics. What key foods should I actually focus on or avoid?
Yeah, okay, great. Let's focus on what foods to eat. So, number one is colorful vegetables. And so we can all list, 10 colorful vegetables that we're willing to eat, I think. So I love, spinach would be terrific. Cabbage, kale, broccoli, cauliflower, carrots, all the colors in vegetables the
Mhm.
red, the orange, the yellow, the green, the purple, all those, have important chemical compounds in them that decrease inflammation. And so you want to eat the rainbow. The same is true for fruit. Now, it is possible to overdo fruit, but berries and citrus and melons and all these fruits, when eaten in moderation, can help with inflammation as well as weight loss. So I'm a fan of eating fruit um, in most cases. Uh, Legumes like beans, we'll call the, beans and lentils, we'll call those vegetables as well. And then healthy fats. So fish and shellfish is a great example. Nuts like walnuts, almonds, it's pecans, etc. I think are really pistachios are great choices. Olive oil is anti-inflammatory, and spices. You want to, almost all the spices that you know about are
Lots of cayenne pepper.
anti-inflammatory. And so meals, consist of protein and vegetables and a little bit of fruit. If 90% of your diet is these healthy foods, then that's a great way to do an anti-inflammatory diet.
And Robert is typing in, he says, yeah, this all sounds great, but discipline is difficult after a life of eating the wrong foods. What's your tip for becoming more disciplined?
Yeah, discipline is hard. So people can't just stop and turn around on a dime and change after eating a certain way for decades. Um, it's hard to be your own police, and when you surround yourself with others who are invested in your health, I've committed my career to lifestyle coaching, and so that's the best is when you can find someone as a coach who can help you stay on track and give advice. So that's a big part of it. Another part is the foods that are unhealthy triggers, keep those out of the household if you can. It's a lot easier to resist temptations if they're not in the house. um, you don't have to be perfect either. No one's 100% perfect, so give yourself a little bit of leeway. You're only aiming to be 90% strict, not 100. So progress, not perfection. And then also, every time you fall off track, it's all about getting back on track. And so there's no one simple solution to the problem, but you know, persistence and reminding yourself what's at stake. For some people, it's all about the best gift they can give to their grandchildren is to take care of their health. And so think about what it means to you and why you're doing it.
Yeah, I always tell people that you never go to the supermarket hungry. And that's number one. And there is something to be said for that. And number two is don't kick yourself for having a craving and partaking in a little bit of indulgence, because that's going to create more stress, more anxiety, and even more cravings
Yeah.
for that very same thing. So if you're going to eat it, enjoy it and move forward and say you prefer to eat healthy and then choose to eat healthy.
Absolutely.
Okay, Sandra, I often eat refined grains and snack on processed foods. Will switching to whole grains and more vegetables really impact my PAD, or is it mostly about medication and exercise? Now, I do want to just throw in a little qualifier here that there are a lot of people that have the MTHFR mutation, and that they're told, like my dad, to go eat a whole bunch of whole grains, and he was going downhill because he didn't realize that he shouldn't be having any sort of enriched flours. So keeping that in mind, as you answer that.
Right. So, Kim, just one more time, repeat the question. I
Sure,
lost my
sorry,
train of
I
thought.
derailed it a little bit, but she often eats a lot of refined
Yeah.
grains and snacks on processed foods, while switching to whole grains and more vegetables really impact her PAD, or is it
Or is it all
mostly
about medicine?
medication and
Yeah.
exercise?
Okay, great question. So both, these are complementary, medications are important when needed, but food is even more important. And so number one most important thing you can do for your health is to eat right and exercise and live healthily. No one wants to be on any more medicine than they truly need to be, but I'm a big believer in medicines when needed. And so for PAD, most people need to be on medication, including cholesterol lowering medication, but switching to a health from an unhealthy eating plan that has lots of refined carbohydrates to something healthier is important, and everyone should make an effort to do that to try to improve their PAD and their arteries in general. And so vegetables are much more valuable than whole grains. Now, whole grains have a place. Kim, you make a really good point about how, it depends on the person. But, vegetables are much, should dominate. And so the results you can see results very quickly when you switch away from refined carbohydrates to other healthy choices like vegetables, fruits, and healthy proteins. And so you can, yes, that's it. Medications are important, but not as important as a healthy diet.
Okay, Nancy, you can go ahead. Grammy, you can go ahead and ask your questions.
Okay. Yeah, I had a couple questions. There's times I feel like I'm not getting enough protein, and I've cut out all my red meat, and I eat chicken, I eat fish, I eat avocados. I'm really changing my whole diet. I'm able to get my A1C down to 6.38. I'm right at that line there with pre-diabetic. My doctor, my endocrinologist PA, she feels I'm not going to be able to get it down to like 5.7. Is it possible for me? I'm a 25-year diabetic. The protein thing, I'm trying to eat a little more protein because I just feel like sometimes I'm not getting enough protein. So I
Okay,
guess
great.
that's a couple of questions here.
Great points. Okay. So you want to get your A1C down even lower than 6.3,
Yes.
and which I agree with.
Mhm.
And you want to get enough protein. So let's start with protein.
Okay.
You know, in my book, fish is number one, and you eat fish.
Mhm.
Some of my patients eat fish up to 5 days a week,
Mhm.
and most people who eat fish are eating it about once a week. And so anything you can do to push that higher is good as long as it's low mercury types of fish.
Mhm.
Some of my patients like sardines
Mhm.
and herring,
Mhm.
and others don't. So if you like sardines or
Mhm.
those other small canned fish, definitely take advantage of that. I never get sick of salmon. So
Yeah, me
that's
neither.
okay. So that's number one. And
Mhm.
then, you already eat a lot of poultry,
Mhm.
and poultry breast I think is terrific. I think egg whites are a terrific source of protein, or even just regular healthy eggs. And
Mhm.
then tofu can be great as long as you take the time and effort to learn how to make it right. And
Mhm.
so you can have protein at breakfast, lunch, and dinner,
Mhm.
and you just need to expand your repertoire of, you know, beans and legumes can be a protein source as well, and then low-fat dairies, cottage cheese, Greek yogurt. I think all of those are winners and terrific, and there's plenty of variety there.
Okay.
Um, as the A1C gets closer and closer to 6, it's hard to push it lower. But by avoiding excess carbohydrate, by eating more protein and less carbohydrate, that
Mhm.
often helps push the A1C lower. If
Okay.
there's any way to reduce uh, to get leaner,
Mhm.
that helps lower the A1C, and then
Mhm.
exercise. So those are those are the ways to do it. An A1C of 6.3 is pretty good.
Mhm.
And at that point, I'm usually more interested in decreasing the doses of the medicines than
Mhm.
pushing trying to get the A1C into the fives.
Mhm.
But congratulations on your progress. Great questions.
I've been working hard, and they
Yeah.
just took me off glimepiride because
Yeah.
in late afternoons, and I'm on 4 medications. I'm on
Mhm.
Ozempic, Farxiga, glimepiride, and metformin. But they wanted me off the glimepiride because I was going down to 60, on my glucose meter in the afternoon. So it's just a lot of juggling and it can be confusing. So I'm doing the best I can with it, and just going to keep working to get it down, but it's not easy. And I have cut out almost all my carbs. I've changed my whole diet.
Yes.
So,
Yeah,
and,
well, congratulations on your progress. I'm glad you're working with your medical team to
hmm
optimize your medications. I
hmm
love it whenever patients can reduce their medications once they get their A1C close to 6. So good
okay.
for you.
Thank you. Thank you. Okay.
Any other questions? You had a friend that you had also mentioned
Yes,
prior
I
to us
do.
starting. Did you want to
I
ask?
do. My cousin, okay, Dr. Dansinger, my cousin, she has pancreatic cancer and she just had Whipple surgery. I'm very worried about her because her diabetes is out of control. She lives in the middle of nowhere in New Hampshire. So she's on Medicare. So if I go to your website, can we get information where maybe she can sign up with you, or how would that work?
Oh,
She's,
great. Yes.
yeah.
So I have a number of Medicare patients in New Hampshire,
Okay.
and I would love to give you the phone number right now.
Yes, go
If
ahead.
if you write down the phone number,
Okay.
that's the best way. So I'll just
Okay.
tell it to you now. It's
Okay.
617
617.
600
Uh-huh.
8863. She can just send me a text message and
Okay.
I
It's
will contact and reach out. So
six.
that's the most efficient way. Another way to do it is just to go to the website, diabetesreversalpartners.com, and there's
Mm-hmm.
a button you can click to provide your phone number so that I can call.
Okay. I'll let her know because she's going in ranges right now. She
Yeah.
just came home from the hospital, and that's a tough surgery. She's 83 years old and she got through it, and they removed a
Yeah.
lot of her pancreas. She was never a diabetic before, and she said, "This is horrible. I don't know what to do." It's going down to 50 at night, but it goes as high as 4 and 500. So she's in trouble, and I'm trying to help her, but I'm like, you need to get with a team of people,
I'm
here.
there
So
for her if she wants to reach out.
okay, great. Thank you. I will give her your telephone number.
Okay, great.
You
Okay,
are
thank you.
so amazing, Dr. Danziger. Okay, let's help more people. We have James who says, okay, you mentioned fish, nuts, and olive oil. The First Harvest, of course, cold pressed extra virgin olive oil is
Yeah.
is the best. In a dark bottle. But James says those get mentioned a lot in inflammatory diets, but I'm on a very tight budget and live in a rural area. What are some affordable options that still hit those anti-inflammatory notes and really fit into my diabetes meal plan well on a budget? Now, I know you can get raw nuts over at the dollar store or Dollar General, so that's one start.
Yeah, absolutely. I was going to say the same thing. All right, let's embrace the dollar store. And I have many patients who live in rural areas, and many of these patients have good access to dollar stores. So, canned fish, let's start with that. Canned salmon, tuna. Again, if you like sardines, you can get them at good prices at the dollar store. So, those are alternatives to some of the more expensive seafood. Um, Also, look for healthy. So, you can sometimes find deals on nuts or nut butters. So, examples would be sunflower seeds
Mhm.
or peanut butter or whatever, sometimes some of the fun of going to the dollar store is you don't know what you're going to see, but you'll usually see some nuts and you might find them at good prices. So that, almonds, for example. Okay, so then frozen fruits and vegetables, they may or may not be at your dollar store, but when frozen fruits and vegetables are usually some of the best bang for your buck when it comes to healthy food. Beans and lentils, another good choice that are very, very affordable. I love beans and lentils as an alternative to rice or pasta or other starchy foods. And then olive oil can be expensive. So, but you can usually find, you know, olive oil for a decent price. And if you're using it, you don't, if you use small amounts, that works. And I'll say something controversial. I don't know what all the negative press on canola oil is about. I just don't think the science is there to really condemn canola oil. So it's not my favorite, but it's filled with omega 3s and it gets a bad rap for being a seed oil and genetically modified, but it's a lot less expensive than olive oil. Um, Avocado oil is another, fairly expensive, alternative to olive oil that is neutral. So those are some of my thoughts about what to do with healthy oils, but you can find olive oil at a decent price.
Yeah, I still don't like, I mean, you have to find a really good canola oil because if it's in, a clear container, you could almost imagine that most of it you see on the store shelves might be rancid. Wouldn't you imagine?
I'm not I'm not convinced. We don't have to agree on everything, Kim. A diversity of opinions. I don't
No,
know.
you never know. I don't know. I just wondered if
But
it's been tested. I've never looked it
yeah,
up.
I think, what we all agree on is that scientific evidence is very important, and that's where we want to get our information and not, guesswork. And so we want, we want scientists to answer the questions that are on our mind using sound methods. So I think we can all agree on that. And it's frustrating when we don't have all the data that we would like and all the questions
Yeah,
answered.
that's always it's always frustrating. You always have to look and see who sponsored
Uh-huh.
the studies that are out there, right? Just
Absolutely. There
always
is
looking.
such a thing as rancid oil, whether it's olive oil, canola
Yep.
oil, or any kind of oil can go rancid if it's on the shelves and exposed to light for a long time.
Yeah, so one of those things is to look at the date. Make sure you look at the date.
Right.
It's really important. Okay. So Linda says my blood sugar sometimes spikes after meals, even though I'm really careful. Could certain foods be driving inflammation that's making my diabetes and PAD worse? How do I know which ones?
Yeah, so the blood sugar spikes, I don't think that's directly from inflammation, inflammation. I think it is from hidden carbohydrate usually, or some people react differently to certain carbohydrate foods. For example, I'll just pick blueberries as an example. For some people, that's going to give them a blood sugar spike, and for other people, it's not. Or certain
Interesting.
vegetables might, some people might get a blood sugar spike after eating, butternut squash, and others might not. And so for some people, um, it's all about kind of trial and error and trying to keep a food log and look for patterns. For some of my patients, the problem is they're eating carbohydrates that spike their blood sugar, that would spike anyone's blood sugar, but it was just hidden and they didn't know it. Like there was sugar mixed into something, or sometimes you just have to be a detective and sleuth it out. And so it's it's not that you're having waves of inflammation so much as I think those blood sugar spikes are hidden carbs.
And that's why you talked about it before, but those systems that the glucose monitor, the continuous glucose monitors, those are really valuable to actually give you in real time what's actually spiking your blood sugar, right?
Yeah, I'm glad you
I'm
mentioned
glad you
that, Kim. These continuous glucose monitors are a game changer. And if you're on diabetes medication, you want to try to see if you can get your doctor to, make that accessible. For other people who can't get it through their insurance, some people are willing to pay for it out of pocket, and now it's easier than ever to get it without a prescription. And it costs a little bit of money, but it can really help identify, you know, which foods are an issue for you.
Okay, so Robert says I've heard that that for PAD, you should limit saturated fats and sodium. Does following an anti-inflammatory diet look different for someone with diabetes and PAD compared to someone who only has one of those? Now, it's interesting they brought up saturated fats because I want to know what some good saturated fats are because RFK came out and said that they're not all bad and they shouldn't be demonized as they have been. And I think this is a good one to end it on because it's loaded and it's
Okay.
politically charged, but we want to know from the real expert.
Okay, sure. So the short answer to your question is no. If you're eating, so if you're trying to, manage, diabetes or peripheral artery disease, for the most part, it's you don't it's the same dietary principles. And some could argue that they're 90% overlapped. So let's just leave it at that and say you're accomplishing something similar. You're improving your artery health and your blood sugar health and your metabolic health by focusing on these healthy foods, including an anti-inflammatory diet. So saturated fat has been vilified for the past 50 or more years. And so it's saturated fat from meat and dairy that's the main concern. And so animal fat from lard or bacon fat or what's in a cheeseburger, that's been thought to be unhealthy, and it still is unhealthy. That saturated fat stiffens
That's
arteries.
saturated fat. I would totally agree with you on that.
It stiffens arteries and it clogs them up and it kills beta cells. And so we're especially concerned with certain types of saturated fat. So scientists categorize them according to how many carbons are in there. So these 16 carbon palmitic acid is the worst offender of all. So that one is guilty as charged. Palmitic acid, no matter where it comes from, is bad. It's pro and it inflames. So then there's the number two offender is that 18 carbon stearic acid, and that one isn't quite as bad. And so that's the kind of saturated fat that's in chocolate and some others. And then, the coconut oil has a mix of these, healthy and unhealthy saturated fats. And so these shorter carbons, the 12s and the 12 that you find in coconut is probably fine, but it's mixed in with the unhealthy fats. And so as a general rule of thumb, I think it's reasonable to say the more solid it is at room temperature, the more problematic it is. But now we're hearing that tallow is fine. I disagree 100% with that. Butter is I think we're going to hear that butter is healthy and has been incorrectly vilified. I don't think that that's correct either. But there's no question in my mind that the bigger offenders are processed sugars, foods with sugar and starch, and that saturated fat is not the number one killer in the diet. I think it's the starch and the sugar. And so saturated fat from meat and dairy is not good for your arteries. And so when it comes to saturated fat, I'm not gonna say that that this country is about to take it in the wrong direction, is what I think the majority of nutrition experts would agree on.
Yeah, I think it's going to be an over where they're not going to listen to the details. It's not about, it's just they're trying to counteract the low fat diet, which was replaced by sugars, right? And starch and all of that. But we're going to completely go in that wrong direction and overcompensate. And everyone's going to be heading to all of the fast food chains to get whatever burger with lots of bacon on top and all of the above. So Dr. Dansinger says just say no. But if you want some one-on-one attention with him, we got quite a few questions that came in today. We only have 30 minutes on Mondays with Dr. Dansinger. So if you need one-on-one time with him and you're in Massachusetts, you are in New Hampshire, New York, Minnesota, Florida, or Virginia, make sure to visit diabetesreversalpartners.com. And don't forget to subscribe to our YouTube channels and like the video for more great content such as this. I hope you have a great week, everybody.
Thank you, Kim. Thanks, everyone.